The heat has been unbearable and all of us are feeling it. Over the last few weeks, many parts of India have been extremely hot. On April 27th in particular, a platform called AQI.in reported that India's 50 cities ranked amongst the hottest in the world in 2026. It is important to remember that heat does not affect everyone in the same way. Infants, children, women, particularly pregnant women, and the elderly are more vulnerable to extreme heat. And for them, the risks can be higher and the impacts can be more serious. Hello, I'm Soumya Swaminathan and this is Science Simply, a podcast from MSSRF, where I break down complex science into simple, useful, clear takeaways. In our last episode, we spoke about how heat affects the human body and the simple steps we can take to stay safe. Today, we take the conversation further and we look at who faces the greatest risk during extreme heat and why temperatures do not affect everyone in the same way. Let us start with children. UNICEF estimates that by 2050, nearly every child on Earth, that's close to 2.2 billion children, will be exposed to frequent heat waves. In India alone, an estimated 350 million children are at risk of experiencing at least one climate-related hazard every year. And UNICEF's Climate Risk Index 2021 places India 26th out of 163 countries. So our children are amongst those facing the highest climate vulnerabilities globally. Children's bodies are still growing. They cannot control their body temperature as well as adults can. They sweat less than adults, but they have a higher metabolism. So which means that their bodies can get hotter. They're generating more heat. They also spend more time outside playing and they're less likely to rehydrate. They often depend on adults to recognize when something is wrong. And so this makes them especially vulnerable to heat. Heat also impacts children in less visible ways. It affects their ability to learn. High temperatures and low hydration make it harder for children to focus in schools. Schools that are poorly ventilated, they also become unsafe spaces for them. And repeated exposure to heat over prolonged periods is linked to chronic diseases later in life because heat also stimulates inflammatory response in the body and it suppresses the immune system, making you more prone to infections and cardiovascular disease in later life. In infants, that's babies under 1 year, undetected heat stress can be deadly. Unlike older children or adults, babies cannot move to a cooler place, they cannot ask for water, they cannot remove extra clothes on their own when they are hot, and they depend entirely on caregivers to recognize signs of heat stress. And their bodies and their responses are still developing. So their regulation of core body temperature is less well developed when the external temperature changes. They also generate more body heat and they absorb more heat. Studies have shown that the process of maintaining the core body temperature is immature in infants, makes them more vulnerable to higher temperatures. And we do see reports of higher mortality in infants during heat stress, including in hospitals if neonatal wards are places where there is a lot of heat accumulating. So we have to be very careful about infants and the kind of signs that they and symptoms that they demonstrate will be irritability, a lot of crying, poor feeding, and maybe even vomiting, less of urine output. These are all warning signs that a child is getting dehydrated and must be taken care of. Women also bear the brunt of heat differently. A recent study that MSSRF did across 7 states of India, covering about 3,500 women, showed that heat not only affected women's physical and mental well-being, but also added to household responsibilities and pressures. Our study found that women reported that they suffered more from anxiety and sleep disruption during the hot summer days. Plus, they faced increasing conflict and instances of domestic violence during periods of extreme heat. For pregnant women, this can not only impact them but also their babies. And while babies in the womb are not directly exposed to the heat outside, they do respond to changes in the mother's body. So it's very important for pregnant women to stay hydrated and to make sure that their core body temperatures don't go up. Of course, we cannot speak about all women as a single group or a single vulnerable group, but it's important to recognize that the experiences of heat are shaped by factors such as income, caste, occupation, housing conditions, and where they live. So, women working outdoors in extreme heat, let's say an agricultural worker, a pregnant woman who's commuting long distances, an elderly woman who's basically indoors but living in a very poorly ventilated home, they may all experience heat but very differently. Older people, especially those over 60, often tend to also have underlying ailments like diabetes or hypertension or other neurological diseases. And studies have shown that in this group, all over the world, actually, not just in India, that excess deaths happen in the elderly during periods of extreme heat. So, anyone who has underlying diseases, particularly heart ailments, because heat stress impacts the heart first, needs to be very careful during periods of extreme heat. We know that heat is not just a climate issue, it is a public health issue. In fact, climate change is a public health issue or even an emergency in some ways. And so we need to understand who are the people at high risk, where do they live, and what can the government and society do to help them. So, one thing is to use satellite imagery and other kinds of technology that is available to us today to understand where heat is concentrated. Urban areas trap heat because of the way that we've built our urban areas with a lot of concrete, a lot of glass, a lot of cement, and very few blue and green spaces. This leads to something called the urban heat island effect. So, how do we cope? What are the solutions? One important step is to strengthen health systems. Hospitals, primary healthcare centers, emergency services, and ambulances, they need to be ready to deal with people who are suffering from any kind of heat related illness. The extreme one, of course, is heat stroke. So, all of these places, particularly emergency wards and ambulances, must readily have cooling pads, ice packs, cold water, and basic supplies to treat dehydration and heat stress. And the staff, health staff, and the frontline workers all need to be trained in first aid management of heat related stress. For the longer term, cities need to rethink the way they are built. Urban areas trap heat because of the excessive use of concrete, glass, and cement in our construction. In fact, roads, buildings, pavements all tend to absorb heat during the day and release it at night, making cities very hot even after sunset. In fact, the IMD has just released data showing that nighttime temperatures are rising faster than daytime temperatures. So, cities actually need fewer concrete surfaces. We need more open soil, grass, trees, blue green spaces. These will not only absorb heat but will also help to store rainwater during the monsoon. Also, our older, more traditional houses used to use materials which were actually more heat resilient and was suitable for our kind of climate. So, clay, mud, lime, thatch roofs, khas, vetiver. I remember growing up as a child, we used to have the coolers that had khas and basically water dripping through them and an exhaust fan that used to pull air in, and that was as effective as air conditioning in dry heat. So, when we're thinking about energy use, we also need to think about these simpler or more passive uh, cooling uh, systems and devices. So we not only need to plan our cities better, more climate sensitive design that includes green roofs, the reflective white paint on roofs, particularly where we have vulnerable groups like hospitals, schools. These are places which really need to think about ventilation as well as keeping temperatures inside reasonably cool. Another step is identifying the most heat vulnerable areas and communities. So, mapping such hotspots using satellite data and using weather station data can help local authorities plan better responses and protect people who are at greater risk during heat waves. At home, what can we do? Well, we can use these khas or vetiver screens We can put an additional layer of thatching on top of, let's say, people who live in tin roof housing, um, drink a lot of water, carry umbrellas while going outdoors, stay in the shade, maybe change the working hours if possible. And this is where the labor codes would also need to come in. Wearing light cotton clothing, which allows you to breathe as well as sweat. And awareness. I think people need to understand the early signs of heat related illness or heat stress, which are things like dizziness, feeling weak, feeling faint, getting dehydrated, not passing urine for a prolonged period. And anyone who has any of these early symptoms, which include a rapid heart rate, must immediately take rest, cool down, drink a lot of water, and seek medical care. So I think, to conclude, extreme heat is no longer a seasonal inconvenience that just comes for a few days and then we can forget about it. It is becoming one of the biggest public health challenges of our time. And while all of us experience the heat, we don't all face the same level of risk or the consequences. A child who is studying in a poorly ventilated classroom, a pregnant woman who has to travel long distances in peak heat, an elderly person living alone, or a woman who works in an informal job, let's say in a factory, without any access to cooling or water or rest. These experiences of heat are very different. And so, for policymakers, I think it's really important to think about the different ways in which heat is impacting the population and to think of relevant, contextual, and affordable solutions that can be applied both at workplaces and at homes. So, heat does not affect everyone equally. It amplifies existing inequalities in health, in housing, in income, and in working conditions and access to care. So, as India prepares for a hotter future, protecting vulnerable populations must become central to our public health response. Thank you for listening.